So just a couple of questions here. I just talked about planning. I don't know how many of you, I don't know what type of communication planning you do. And I know this is a group of close to 40 people now. Does anyone here do 12 months of communication planning all at once? Does anyone do that? And probably not. Does anyone do some type of quarterly communication plan? So I'm not hearing that, but I know from a couple of calls I've had that there are people who are thinking about doing their communication work, on a 3-month basis. So every 3 months they get together, think about maybe a topic or series of topics they want to talk about, and then plan out their communication. So you may have a topic of the month, and then you may have subtopics within that topic that help guide your communication. And I think one thing that does is it gives you something to talk about. So for example, I'll talk about this in just a second, but a couple of districts I'm working with or counties I'm working with are focused on mental health. So we're doing work around mental health. That's the overarching theme for this month, for March. And then every week there's different media. So there's maybe it's children's mental health, maybe it's mental health and screen time, or whatever those topics are. But that gives you something to communicate about consistently. It gives you an intentional plan for your messaging, so you're not just posting Facebook posts or resharing posts from the state or from the institute, but you're really thinking about and creating material that's sensitive to your community's needs. And one of the things the institute did a survey, and for those who responded, the top issue that came up was also mental health. So that's just an example of, people in communities are talking about an issue, people are maybe asking about those questions. If you can go ahead and get ahead of those issues, that can help you in terms of credibility and trust. And the other thing is, I hear a lot that people are overwhelmed, especially with COVID, because that took up so much time. And then the idea of planning for a whole quarter sounds overwhelming. What I would encourage is, if you have the time to sit and do some thinking and planning out, here's the topic for March, here's the topic for April, and here's the topic for May, that can really help guide people. That can really help guide people in terms of are we posting something? Is it related to our theme? So it's March mental health is what we're posting related to that. Certainly other issues are going to come up, but that gives you something to think about for a month at a time. Pam here says in the chat that annual planning is daunting, and I would agree, but that they've started quarterly planning, and I think that's a great practice, just in terms of, at the very least, thinking about what is my communication goal for this month. What topic? Another question I got there in the chat was who to be included. So I think it depends upon the size of your department. I know there are some relatively small departments, so a lot of times there are people doing multiple jobs. To me, again, having the time, setting aside the time to do a plan can help with that, because now you have, again, a topical focus. So if you can take even an hour out of a 3-month period and just think about, these are the topics I want to focus on for the next 3 months. And then, I know that there's help available through the Institute and other ways that you can, and from the state, that you can get resources that you need. So here's the topic I have. Now I need to collect the resources to fill in for that topic. So to answer the other question, you see there, I'm recommending quarterly planning, but who do you include? So if you're a small department especially, I think it's important to think about community partners. Who do you work with? Is there a hospital or healthcare provider? Are there elected officials you want to talk to about what issues are going on? You need to be including people in that conversation so that you're responsive to the community. Maybe it is somebody at the paper. even if they're only delivering once a month, but if there's somebody there that you can talk to and build a relationship with, and just ask them what they're hearing. So, you know, if you can get a sense of what issues your community wants and you can be responsive, that can head off a lot of concerns. If you're putting out accurate and usable information about topics that people want to hear about, they're going to keep coming to the health department. So again, moving past COVID, I think a lot of what health departments need to do is rebuild or build credibility. And so being responsive to community needs can be really helpful. The other thing is, especially if you're in a small department, I have your public health communications buddies. Find a health department that's like yours and set a date, once a quarter at least, to check in with that person and see what they're planning. That can be really helpful. Go for it, Greg. You can absolutely make a comment.
Yeah, I was just going to, thanks for, it's great and listening in. One thing with people talking about being overwhelmed and things that I think about, especially in the communication plans in different areas, and also I think it shows your commitment to your community, is let other people speak through you. So let, those organizations, those groups, that concerned parent that has had that personal experience with something that they would like to talk about, you still control the content. So I'm not saying open it up and let them say whatever they dang well please, but it's a great way to work with them and say, hey, we can help find some of the data for you or whatever, so we can get a good message. But then you have others in the community that are taking on that responsibility, and it's a relationship that you've built to help out in the next situation. So it's a great way to just start making those inroads and also help you get things done. And also, I think it shows more commitment. I mean, we have breast awareness day, breast cancer awareness day, and we have all these different types of things, and that's fine and good. But we got to remember, we also have, Poodle Day or whatever the different things are. People don't take them very serious anymore. And when it's just passed along, it's when you can bring it to your own community level, that's just awesome. So just a thought. Thanks.
Yeah, that is a great point. I think stepping back just a little bit, that's the importance of community partners. If you have a provider or an elected official or a concerned parent or someone who can talk about an issue, whether that's in an op-ed or a social media post, that can be super helpful. And then it's not just coming from the health department. And so that's another way to build credibility is, there's a trusted partner that people know in the community that can be helpful. And I definitely think the third point here, just having someone you can bounce ideas off of. I'm certainly available to talk and help you plan a calendar and whatever. I'm available in Montana at least through July, so I can do that. But part of that to me is I want to encourage you just to call people. As I've been doing kind of one-on-one phone calls, I've been hearing very similar concerns, and so I would encourage you going forward to think about one or two people, especially if you're in a smaller department, that you can bounce ideas off of, that you can at the very least plan quarterly meetings with to talk about, hey, what are we doing? You can share resources. You can talk about an idea that you had that worked. Just having someone to talk with about what's frustrating, what you're doing that's working, what kind of partners you have, what resources they've found from the state or the CDC or the Institute or wherever can be helpful. Maybe there's something they've thought about that you haven't done, or maybe they did a communication outreach project that you want to replicate. But I think the big picture takeaway is you don't have to do it by yourself. Reaching out to your community helps build trust. Reaching out to other health departments can help you feel supported, and you can support someone else. And oftentimes, the idea that works in one place can work somewhere else, if you localize it. So, so the next topic for me, how do you go about doing this type of planning? I think one thing that I've tried to talk about and work on with pieces that we've developed, and the Voices for Vaccines campaign that Pam talked about is an example of this. And the work that I'm doing with a couple other departments on mental health is another example. Rather than thinking about, I have to do an op-ed and a newsletter and all of these things, think about content in ways that is multi-purpose. So the way I like to think about it is I like to think about, what's the longest or most involved piece of content I'm going to do, and a lot of times that's an op-ed. That's, depending upon where you are, 500, maybe some places will publish more than that, maybe 1,000 words. Tends to be text heavy, may have some pictures, or maybe that's a newsletter piece. And so that's your piece of content. So for example, and we'll talk about a plan a little later in the presentation, but if your topic is mental health for the month, then you may want a piece of content every week that you could do in a newsletter or put in the paper. Even if in thinking about this, I like to think about it on a weekly basis. That gives you, 4 entry points in a month. That you could certainly do more than that or less. But if you think about it that way, that gives you plenty of content. So start with the long form of the newsletter type piece, the op-ed type piece, and then think about what would make that kind of come alive in a social post. What do you need for Facebook? Well, you need pictures for one, probably shorter text. And so the same with Instagram. You can have a picture on Instagram and write a lot of stuff, but people aren't really reading the words. So thinking about the medium where you're sharing it, you could also in Facebook especially, link to a longer post. If you get an op-ed published in a paper that's online, you can share that in a post and get people to read. But think about the formatting, and then one thing that I'm interested in and would love to see more of, is using short videos. So whether that's an Instagram story or TikTok is. And I've talked with one district about the possibility, but is anyone actively using TikTok for social posts? So maybe not. I think that could also be, to a couple of the earlier concerns, I think that could be a fun way to kind of rebuild some trust. I think, letting people know that your health department is accessible at all levels, that reaches a demographic typically much younger, people my daughter's age. But that's one way to reach an audience that we may not be reaching. And it also may be a way to have some fun. That could also rebuild some community interest. So on that end of the spectrum, if your community is only having newspaper delivered once a month, the one thing I would say is you definitely need to make sure you have something ready for the paper once a month. So again, if your topic's mental health, maybe instead of 4 pieces, you develop one long piece that answers a lot of questions in that case. But at the very minimum, you're reaching out that way, taking advantage of all of those things. But rather than writing one big piece, you're writing that big piece and then breaking it down into smaller pieces. And so that can save you a little bit of time. So the next thing is just kind of I've kind of given an overview of this or talked about it, but just a plan. So Pam says that they're starting to use TikTok, and then Maureen says they did some last year, but not consistently. But that's a great way, I think, to reach a demographic that we may not be reaching very much. Thinking about, just a sample calendar, this is what you want to do for every month. So again, thinking about 3 topics that you want to cover. So you have a topic of the month, and that kind of governs all of your social posts and even your op-ed writing and all of that. So you're on a topic all the time. So I'm going to go back to that example. The topic for this month is mental health. First week, just kind of an overview. mental health issues, what type of resources are available, maybe a link to some resources. Week 2, mental health and screen time. Week 3, mental health and physical activity, and then maybe a rehash. Week 4, what are some resources in the community? And I'm using this as an example, but I'm also producing this type of content for a couple of districts. So I think I saw Stephanie here, and she's one of the people who's getting this. If it's something you want, by the way, absolutely get in touch with me, and I can get you the content that I developed for them, so you can use it if it's, make it local for you, but it can be usable. But I put this up here just to show this can be super simple. So if you think, oh, I'm doing quarterly planning, that's going to be a ton of work. I don't have time to do this. I really think that in a very short period of time, every quarter, you can come up with 3 monthly topics, and then think about, breaking that down into 4, subtopics. And then as you develop that piece a week, that will generate social posts. That will cause you to look for social posts. I know the Institute puts out social material, and that could be helpful. But as you are thinking about quarterly planning, I think the key is, I hear a lot of people are overwhelmed. Greg spoke to that. Keeping it really simple. So topic of the month, what are the 4 subtopics? Develop some pieces, break those out into smaller pieces to fill my social. And then I think, well, it's March, it's mental health. That's what I'm working on all the time. And so you're thinking about that, whoever's managing your communications or your social is thinking about that. You're pulling resources. Part of that planning is, where are the resources for this topic? What is already out there? What did we use 2 years ago before it was all COVID all the time? It's very possible you have a lot of material already that would be relevant, can maybe be updated on these topics. So I think too, it may sound overwhelming, but I think, I would encourage you to keep it really simple and focus on planning in a way that is manageable. Does anyone have questions right now about these topics, how to plan? I saw a couple of things in the chat, but any questions, thoughts? Okay, so we will go on. I think I've already talked about this. Each month has a theme. Each week focuses on one aspect of that theme. Each piece can be repurposed for multiple uses. So I think that's the one key, is you don't have to be overwhelmed and think about, oh, I've got to make all of this material. You can develop one piece and then keep it relatively simple, and that can be used for multiple purposes and keep you with constant content. I think the one thing is just constant, meaningful engagement with reliable, accurate information. If we're talking about rebuilding trust or getting the community engaged, that can be helpful. I think it's interesting. I would love to follow up with a couple of people who have talked about using TikTok, because I do think that's, for a lot of the topics we talk about, that's an audience that may not be being reached in other ways, certainly not on Facebook. And so, we're in the paper. So if we can, go in the other direction and reach younger people, and then for the aging population, I think I think one is we absolutely have to use the newspaper, and then we have to think about other ways to get into spaces where people get information. So I alluded to Pam, and Pam mentioned this early on, but the Voices for Vaccines campaign is an example of the type of, thinking about a media campaign and then how it works and how to integrate pieces all together. So, Pam had a couple of people that were interested in sharing their story and had this idea. And then I agreed to conduct interviews and write stories and create a campaign. And then the Institute has a graphic design person we work with. And so all of that came together. So just as a sample, that started out with identifying, and Greg alluded to this, for any topic, whether it's mental health or general vaccines or whatever your topic is, If you have community partners, people who want to speak, parents, county commissioners, whoever, these people can be partners and can be voices, and they're telling the health department story, so it's not coming from the health department, and that kind of gets to that credibility issue. So in this case, I believe there were 6 stories, so I did a series of interviews, just talked to people, listened to their story, took notes, wrote the story up in a narrative, got the person to approve that story. So these were, I say, short stories, 500 to 700 word stories, sometimes a little bit shorter than that, depending upon how much they wanted to share. Got some pictures from the people we interviewed, and then turned them into an op-ed, and then a range of social posts that both the Institute has used and Pam has used, and I think has created some pretty good feedback in the community. So let me look at a couple of questions before I go on. Yeah, once a week. To Margaret's question, what type of posting schedule? To me, it's like a weekly. So you have a monthly campaign. You want to post at least once a week. Now, I've talked to people who have said, once a week doesn't seem like enough. We post a lot more. I think to me, that's a minimum. So you're going to post once a week. You can certainly post more than that. I think the key is to keep your topic in mind. And then question about the newsletter, long form, I think that just to me is a longer piece. So some of the pieces, and Stephanie, specific to your question, are less than 300 words. A longer form piece to me would be 750 to 1,000 words. If you're doing a newsletter, you may have several pieces at once. You may have several pieces on mental health, for example, in a newsletter. That's a long form piece, and then you would take those pieces out and break them into the post. So to Margaret's question, that's, you would have one post a week. In the example of the Voices for Vaccines, Pam just said that she got some great feedback. To me, the great part about that, Pam is great, but this was other people telling the story. So you had a mom, you had a dad, you had a county commissioner, and you had a rancher. You had a range of people in Jefferson County telling the story about why they got vaccinated. And so that became, it wasn't the health department spreading out some big government misinformation or whatever. It was people in the community saying, hey, this is my story. But that works for any other topic. I think Greg made a great point. You want your community partners telling the story. Someone talking about the importance of maybe it's a school counselor talking about the importance of mental health for kids, or a coach talking about physical activity and mental health or whatever. So you've got someone else partnering with you to share the story, and that can be helpful. This is just an example of the social media piece that we developed. We did 6 or 8 of these, I think, depending upon the messages. So Terry and Brud are ranchers there in Jefferson County, and they're just telling the story of why they got vaccinated. Like I mentioned, there was a county commissioner, there was a mom, there were different people telling their story, but this is just a sample of, conducting an interview, writing everything down, and then working with social. And I say this too, once you've identified the people to share the story, there is help for you, at least for now. That's something that I can help with, that we can help with through the Institute. I know that there are other resources being developed. So if there are topics like mental health that you want to talk about, we can start developing these materials so that you can have them. And then, for a topic like the COVID vaccine, that's a one-time, kind of thing for right now. But for something like mental health or, another topic, if you develop some materials you can use, you can rotate them. So, maybe you do mental health all the way through March or May or whatever, and then 6 months later you can recycle one of the pieces if you need to. So that could be helpful. So that's just an example of this became also an op-ed, became a story in the community. you know, Pam did the groundwork of identifying the people, and then there were people who conducted the interviews and wrote the stories up, and that can be done for just about any type of topic. So that's we'll go on to the next topic in just a minute, but that's the end of, for me, the media planning piece. Does anyone have questions? I know I've gotten a couple of questions in the chat. Does anyone have questions or things they want to talk about media planning before we go on? Everybody's good on media planning? Okay, so we'll go into the media relations strategy piece, probably just a few minutes into this. Well, 10 or 15, we'll see how this goes, and then we'll maybe take a little break. But I would love to hear, I know I've gotten comments in the chat on the other topic. You know, do you have a media relations point person, someone whose job it is to talk to the media? Do you have a small staff and that's your job? Just kind of what's the variety of media relations? What's your expectation when you get a call from the media? Is there a specific person? Is there not? How does that work in your district? So would love to hear some feedback or see some in the chat about that.
We just have the local paper basically calls the office, and depending on what they want to talk about, a lot of times they talk to me as the director, but they also talk to our emergency preparedness person. They also talk to our family planning person. It just kind of depends on the topic that they want to talk to.
Okay. So you just have, you take a question and then direct that to whoever is appropriate. Are there other people who want to kind of talk about how you handle media calls? And I realize you may not be getting a ton of calls if maybe you have a paper or whatever the media situation is, but
in Hill County, I am the only one that talks directly to the media because I've taken some public information officer training. That was my job before becoming the director and the health officer. And now we have Brandy, who is training to also assist me with that. She does a lot of the social media posts now. I handed that off to her. But I am the only one that speaks to the media.
Okay. Other people?
At Riverstone Health, we have a communications team of 3 people, and the vice president for communications and public relations is the chief spokesperson. But Casey and I are also very experienced at talking to the media, and we, for better or worse, have had at least one news release that goes out to a very large media list at least once a week. More often with COVID and different community activities, we reach out to media in the community when there's a topic that we think that the community needs to know more about, and we can get a more in-depth coverage. We also work with our multiple local newspapers to get regular articles published weekly or monthly. We work with the local TV station for PSAs. We're just looking, and Casey is posting multiple posts a day on Facebook. We keep our website updated, so we're really trying to have relationships with local journalists and on not just COVID, but on everything that touches public health.
Okay, that's great, and that sounds like, one, you have some staff which is dedicated to communications, and 2, that you're being very intentional about talking to the media outside of just answering phone calls. You're being intentional about going forward and putting information out there and having conversations. And so I know not everyone has the staffing level to do that, but I would definitely encourage people at the health department level to be intentional about reaching out to the media, about having those conversations, about talking about what people want to talk about. It sounds like in Pat's case, you're having some success getting things covered, and you're doing PSAs and being very proactive. But even if
May I
you,
add one other thing? We have asked all of our staff at Riverstone Health if they receive a request from the media to run it through the communications team. So we know who's talking, we can make sure everybody is appropriate and we all know what each other is saying.
yeah, and that's all there in the chat too. But it's great to have that. Are people getting requests from the media? So making sure people are reporting that. So it's one thing if someone from the press calls in and says, "Hey," and then someone takes that call, but they don't tell anybody, and then it just maybe there's somebody who's frustrated in the media. And the other thing is if you haven't been trained on how to answer questions, and a lot of times how not to answer questions, something can be taken out of context, and a story can get out of hand pretty quickly. And so in the chat, the person said they were the PIO for their county, and they handled all the requests. And I think something like that, I think the point I'm trying to get at here, first of all, is having a point person, maybe multiple, but one person whose job it is, to know that all these requests came in. Someone called John Smith today and asked this question, and John didn't just write a note about it. He told the PIO, "Hey, I got this call," so that there's one person kind of keeping track of what types of requests are coming in, and then who's talking to the media and what messaging is going out, so that can be managed in a way that's intentional and thoughtful and puts accurate information out there. I think, my experience working in 911 and then again here in public health is people don't want to give out bad information. Sometimes they just say stuff. But if you just say stuff, sometimes that's more information than the public needs, or it can feed a conspiracy theory or whatever. So there's often very good intent behind talking to the press, but that can get out of hand quickly. So having someone kind of track all of that and some basic training on how to answer questions can be really important. I think the other part of that is making sure that there's some sort of clear policy. So what happens when the media calls? Do you answer them right away? The short answer should be probably not. Who gets informed? What is the expected timeline? Do you have an expectation for turning around media requests? And is there someone who needs to look at a document before it goes back out, or someone who needs to practice if you're going to do something on TV or radio? But I think having a clear policy for all of those things and making sure everyone on staff knows what that policy is really important. So to me, just a couple of 3 goals here for media relations. One, I think it's really important to have a very clear policy. So who's going to talk? When are they going to talk? What is your timeline? Do all requests go through a PIO and they get filtered back out? Who sees whatever message is sent out there? So if you're emailing back a reporter or whatever, who has to see that and sign off on it before it gets out of your office? What's what is your anticipated timeline or turnaround time? Those types of things should be in a clear policy. One of the things Amy alluded to, but with the material that will go out after this, I'll also send out a sample media calendar and a sample media relations policy, so that we can, if you don't already have something in place, you could adopt that or adapt it to your needs. So some of the material you will get after this workshop will include a sample media policy. So if you don't have one, that's something to be thinking about. And then you'll get a sample policy that maybe you can adapt. The other piece for me is building relationships. So, talking to reporters, this is one way to kind of get an idea of what's going on, but it's also a way to get them to trust you. I have here, a lesson I learned early on in my career doing at a PR firm. you know, I know especially in small communities, and you know, I'm in Tennessee, and um, a lot of rural communities where you know, the reporters are also Sunday school teachers and whatever, and you see them all the time. You know, but a reporter always wants to get the story and tell the story. So in that sense, I have here, reporters are not your friends. They're not your friends because they have a job, and their job is to tell a story. And so if they get the story from you, you know, because you all had a great lunch or whatever, you know, their job is to tell the story. So I say that not to say that you shouldn't be friends with reporters. I want you to build those relationships and be intentional about it. But to be aware, if you're talking to a reporter, maybe you think you're off the record, but you're pretty much always on the record. Pam writes here that she tries to have the media email her, so she has time to write a response. That's also a great idea. You know, and then the third point I have here, you know, you don't have to talk to the media. I know there are public records, open records, those types of rules that govern, but to Pam's point, you don't have to say something right then. So if someone calls you and has a question, you can tell them you'll get back with them. You can have them email you their questions so you know exactly what they're asking, and you also have time to process. You know, part of the media policy should be, in my mind, you don't have to talk right away. One of the things that we ran into with 911 a lot is people would want information, of course, as an event was happening. You know, the calls are public records, and so people would want that. And I would always encourage them to wait for something super sensitive, you know, at least a 24-hour period. So that may frustrate your reporter friend, and they may say, well, I want it now, or this is going to be a cold story in a day, you know, something, whatever. But that's, you know, your job is to be concerned about public health and accurate information. Your job is not to sell papers or make the TV station happy, or radio or whatever. So it is perfectly fine to say no. It is perfectly fine to ask for an email. It is perfectly fine to say you'll only give a written response. All of those are acceptable things to do. Certainly reporters, you know, want to get a story, and they want to get a story out of you, so they're going to talk to you in ways that may try to push information out of you. So the next piece of that puzzle gets back to one, do you even have a media policy? So you should, and you'll get a sample one. Two, thinking about what is in that. We just talked about that a little bit, but who talks to the media? Do you have a PIO or a dedicated comms person? What's the timeline in terms of getting things back? What's the response time, and what's the approval process? And then the other thing, and Pat alluded to this, but I think you should be reviewing that policy with everyone who you hire, so that, you know, it's possible that anyone who's in the department may get asked a question. So making sure they know that. And then I think all staff need to just be reminded of it, you know, every year, just to say, you know, hey, this is the media policy. That could be as part of a staff meeting. It could be a document you email out and highlight, you know, get an acknowledgement back, but making sure that you are being thoughtful about keeping your staff informed around media can be really important. Let's see. Amy says too, she does the same thing around email. So it's a little bit after 11, and we've been doing this for about an hour based on when people came on. Does anyone have questions about where we are right now before we take about a 10-minute break? Okay, so we ended talking about media policy. I covered that. So the next element of media relations and being strategic is to think about, we asked some of these questions, you know, we got a couple of answers, but, you know, who is covering your work? For a lot of places, it's probably a local paper. Is there a radio station? Is there a TV station? Who is out there? You know, when you get media calls, who is it from? Is it from a local paper or radio? just thinking about that. So step one is that. Step two, how often are you talking with those people? So are you seeking them out, or are you just waiting to be called? You know, I would encourage you to seek people out, to share information, to ask them. You know, we had the question early on, how do we reach an audience, especially if you're talking with the paper, which tends to reach an older demographic. You know, you should be asking them questions about what they're hearing, because they want to sell papers. I mean, that's, you know, that's their livelihood. You know, so to that point, what's their motivation? Reporters are wanting to tell a story. Stories sell papers, even if that content is put online. You know, they want the story that people want to read. They want the story that people are going to share on Facebook. You know, and that reaches a demographic that tends to be 40 and up. You know, having those conversations can be important. You know, this whole workshop is about being intentional, but I want to encourage you to think about, you know, Pat talked about sending out press releases and doing PSAs. You know, people who are writing papers, and especially for online content, they need stories, and public health stories or good news stories or useful stories. You can offer information that people in the community want to know. So the newspaper or even a radio station can be a great friend to you, can be a great resource, because you can write the stories, you can tell the information, and then it can be coming to an audience by a trusted source. I think the other piece of that is that you can have community partners share the stories. So, you know, the Voices for Vaccines is an example of that. But with any topic, you can be the one putting out the information, and that way it's accurate. I think the long-term message is, if you put out consistent, accurate information, you're going to overcome some of these trust barriers. I know, you know, COVID has possibly made that difficult. And then I think one of the things I keep hearing is that people forget the health department does anything but COVID. So just letting people know that you're out there and that you're doing things that are not COVID related, but you're doing other things that are useful, can be really, really helpful. So just remembering, if you're only talking to the media when they call you, you're missing out. If you're only talking to the media when you want them to put a story in the paper, you're also missing out. You should just be having those conversations. They can be good partners. You know, the public health and public information worlds have mutual interests. And so a TV station, a radio station, a newspaper wants information. You want information to get out. So you can definitely have a symbiotic relationship there that can be really helpful. So the next thing I want you to do in groups, and we'll talk a little bit after this, but while you're doing this, but I would love for everyone here, I'll pick a few of you to actually do it, or you can volunteer. I want you to think about a word that is not a word, so make up a word in your head, and then make up a definition and a way to use it. And there's a reason for this, but what I really want you to do is make up just a pretend word that you think should be a word, define that word, and then be able to explain how we would use that in context. So take just a couple of minutes to do that while I'll talk some more about media relations. But this can be a helpful exercise in terms of understanding how the media works. And actually, I said I would talk, but I'll actually give you just a couple of minutes to do it. And so I'm not distracted. Okay, Amy has the word can be anything you want, Margaret. So I want you to just think about a word, make it up, and then make up a definition. If Amy's ready to share, that could be a good starting point. So we could start with Amy, and then we'd love to do just a couple of these to see how it goes.
So just so I know that I understood the assignment correctly, we are making up a word, correct?
That
And
is
then a
absolutely-
definition.
Mhm.
Okay, one of my favorite words that's not actually a word, but I love using it is strategery.
Mhm.
And I would define that as the act of intentional action.
Okay. Okay, that's a good example. Does anyone else have one they want to share? Emily approves.
I have one. It's a silly one though.
Yeah, the sillier the better.
It's Janj, Janj. It's like to describe things that can't really be described, like, oh, your hat is so Janj.
Like maybe a compliment, maybe.
Yeah, we're not really sure what it is. So, but it's meant to be a bit ambiguous.
Okay. Who else? I'd love to get at least a couple more just to.
I like to use the word nincompoop. I use it for the naysayers. I usually call them a nincompoop.
I like it. Okay. Let's see. Yes, Michelle is one of my favorite. Hangry, irritability due to being hungry. That is happens to me about 5 every day. So, so that is a good one. Is there any? We have 1 or 2 more. Anybody else want to share a word? Okay, so we got some good ones. Hangry, nincompoop, Janj, which I think would be an interesting one to use. The point of that, back this up. The point of that for me really is when you're talking to the media and you have the information, you can, this is not a permission to make stuff up, but you can say whatever you want. You know, you get to tell your story. You can define your story. You can introduce information. Members of the media are coming to you because you're the experts on, you know, whatever issue it is, whether it's, you know, maybe drug use and abuse in your community, or mental health, or COVID for the last couple of years. I mean, so these topics that keep popping up, you are the expert. So if you are intentional and thoughtful and focused, you can define what's the news. And so, you know, sending out press releases, providing relevant information, designing content, creating, you know, intentional campaigns around, you know, the vaccines is one example. We'll have an example in a minute in social media about monoclonal antibodies. You can decide how that information gets used. And so you, as the expert in the field, can be a word definer. You can make things, and I'm encouraging not to make things up, use accurate things, but you can tell the story the way you want to. And especially this is true in social media. I mean, everyone is telling a story, creating a brand, being, you know, the best versions of themselves in various posts, but there's no reason why public health can't do that too. And I think one of the keys coming out of COVID is reminding people, A, we're here, and B, we do lots of neat stuff. You know, and I've heard from some of you that you know, getting people into your health department is a great opportunity to also just remind them that, you know, maybe you do offer the vaccine or they can get a vaccine. So bringing that up too can be important, but you have an opportunity to you have an opportunity to define the story. So Francis here mentions a challenge about being misquoted. And I think that goes back to our earlier point around, asking for things in writing, giving back answers in writing. That can be frustrating. Early on in some of the work I did in PR, I would make the mistake of talking to someone right away. And I had a supervisor who encouraged me, even if it's 5 minutes, to tell somebody I can call them back, and take a minute and be thoughtful. I like the idea of giving people information and being quick on my feet and all of those things. And sometimes it's okay to pause, so you get it right. So if you have the issue of being misquoted, and I think that gets back to, you can define the story. And so it's okay to take a minute. Hey, can I call you back in 30 minutes? Or, in some of the examples we had here, I'm going to find the person in our department who's the best to talk to you about that. Then you're going to go have a conversation with that person. You're going to agree on the best way to put the information out. I'm a big fan of, if it's possible, to get questions in writing, and to have responses back in writing, and that gives you some control over the story. So that can be really helpful. Yeah, and then yeah, Stephanie says here, if my phone, write down key points. So again, taking just a few minutes to call somebody back can give you a chance to write down talking points. If you're the expert talking about an issue, talk to a comms person and think about, what are the best ways to convey this message. I like to think about the rule of 3. So what are the 3 things I would want you to know about, the COVID vaccine, for example, and then talk about that. The other part of that is, you don't have to talk beyond that. So if you have a talking point script and you have 3 things you want to say, and they keep asking for more information, you can just keep referring back to your 3 points. We've probably a lot seen political debates or conversations where people only keep repeating themselves in different ways. They do that on purpose to control the message, because if you don't say something, it can't be part of the story. And so if you keep focusing on, for example, your rule of 3 and your 3 talking points, when you're doing a phone interview, that becomes the story, and you control the narrative. And so you've defined something new for the news. And so, I really want to impress that you have an opportunity, and especially in this world of people being very hungry for content, you have a great opportunity to control the narrative and to put out accurate information that is helpful for your community. That happens by partnering with the media, by getting to know what stories they want, by getting to know what they're getting asked, so that you can tell the story that's most helpful and accurate. And again, over time, if you give out information that continues to be accurate and helpful and reliable and people use and people refer to, and community partners are repeating the story and it's on the radio and so on, that will establish credibility for you and for your department. I know I said this before, but I want to reiterate, so I have it a whole slide. It is okay to not respond to the media. So if there are questions that are uncomfortable, you don't have an answer, it takes time, that's okay. I realize that in public health, just like in other areas of the public, some issues are subject to public records or open records. There's usually a timeline, so you usually don't have to give that to them right then. Some information can be redacted, et cetera. So there's all kinds of ways that you can be sensitive. In Tennessee, you have 7 days to respond if you have the record. So I encourage departments to take as much time as they need up to that. Transparency is great. So I think the more you're in that relationship and having that conversation back and forth, you feel trusted. And then I think you also need to be mindful of things and how they are perceived. And so you don't have to say everything. And so the last point, the more you say, sometimes it gets worse. So that goes back to keeping things on your talking point, keeping things on your script, writing down, these are the 3 things I want you to say, and then saying them over and over again. If we're talking about getting the public to listen to, buy in, respond, to understand an issue, if you say 5 or 6 or 8 takeaways, that's way too many. So you need to focus on a couple of things and just stay on message. That can be frustrating. It can be difficult because you may be tempted to say more, but really focusing on limiting and keeping the information accurate.
Andy, can I jump in again? real
Yeah,
quick?
absolutely.
Sorry, I just
No,
want
that's
to,
great.
it's really repeating what you said, but in the CDC training and stuff that we always talk about CDC, there's a word we use, SACO. What's your single overriding communicating objective? And then I keep in mind some transition sentences to think about that you're always ready for in the media. So as Andy talked about, you can move off of the question they ask and move into the answer you want to make sure the community understands. So you can say, you know, that's an interesting question, but I think the major overall point that we want to get out to the community is ... And so you can say some things in a very positive way, or even, you know, say, you're kind of being clarifying to the community that you don't want the waters to get muddled up with a lot of different messages. So let me be clear on what that's important. That's interesting way of you asking it that way, but this is the major point we're trying to get across. You know, just thinking about how those transitions, and I have a few of those in my mind that I always kind of keep, that gets me a little bit prepared to keep going back to what we call the SACOs, or as Andy called them, the 3 overriding points, or whatever your topic is that you're trying to get across as you're thinking about it. Thanks.
Yeah, and Greg, Margaret here has asked for the acronym, so if you could put that in the chat, that'd be great for everybody.
Sure. Yeah.
So that's a great point. You know, you can always, and I think to Greg's point, and to repeat this because I think it bears repeating a little bit, you can always shift and say, you know, what we're hearing from the community is, or what we want the community to know is, and that goes back to, you can control the message. And so always, you don't work for the paper. Maybe they are your friend, maybe they are somebody you know, but your job is to get an overarching message out there, or 3 key pieces of information. And, you know, beyond, if you're talking about more than 3 things, it is definitely too many. And really the single overarching message maybe even better. So what's the one thing, maybe you say it 3 different ways to get that message out, is really important, and you don't have to talk about anything else. And that way you are controlling the message, you are defining the word, you are commanding the narrative. Does anyone have other questions on kind of those general media relations strategies before we talk about social media, which is next on our timeline? Yeah, so Greg put that in there, SACO, single overriding communication objective. That is a great thought to keep in mind. Anything else about media relations before we go on? Okay, so the next piece of this is social media, and I'm going to go ahead and throw this out there and see. I'm suspecting it will be similar, but how many of you, or do you have, anyone here have, it sounds like some of you do, a dedicated social media person?
We have 3 people with access to our social media. Since we got an AmeriCorps member, that is her primary objective right now, and she's doing an amazing job, way better than the few of us that had access to it and just would throw up a post here and there. So I believe after she leaves, we will continue that realm of having one person that be their primary position.
Okay, and then I saw in the chat there's one person who said they were the dedicated person, and then Amy mentioned that there were 2 that had access to post. So other experiences around social media? So I think, you know, the experiences that I've heard around the state, vary. There are usually, maybe multiple people who have access, and some places there is a person who's the primary social media person, which I think would be the recommended the way to go. Is if you can dedicate someone, that's not their only job probably, but who has that as one of their primary tasks, and they're the point person on social media, just like you have a point person on who would talk to the media. That can be helpful. How often are you all posting? I've heard a range just in some of the calls I've had, but how often do some of you post?
We try to post daily and sometimes a couple times a day.
Other people? Yeah, Casey, 1 to 2 times a day. Amy, 5 to 10 times a week. Pam is daily. So that's good. I think, we talked about in the media planning, having these overarching, topics of the week. But I think ideally, if you want engagement, it is important to post something every day. Especially if you're not posting on the weekend. If you're posting 5 days a week, but if you're posting 7, that's great. One of you uses a marketing company. So I think that level of engagement is ideal. So the other part of that to me would be making sure that when you post, it's not random, that it's part of an intentional plan. So you have a topic of the month, maybe you have a subtopic for the week, and you're posting focused pieces. You're resharing. If you have a piece that becomes a story on TV or radio or in the print media, that you use that and push out those posts on your socials. We talked about platforms, so I know just from looking around that a lot of you use Facebook and or Instagram. There are a couple who mentioned TikTok. I don't know that anyone is using Twitter. I've seen that in other. Let me just say, is anyone using Twitter? Does anybody have any experience doing that? So I'm not hearing or see. Let's see who's. Emily says yes. So that.
Andy, I'm just going to add one last thing, and then I'm going to get off. I have to jump off for 11 o'clock, so I'll quit interrupting you and being a pest. So I apologize.
No,
but I did a quick search. If you put in single overriding communicative objectives, there's the worksheets that are already out there that are kind of fun. I just gave you one that they filled out that's an example, but you can see how what is your message? What are your key facts? What is your audience? Which I think is another important one to think about of who you're talking to. And then you just kind of fill that out to yourself beforehand, in that 5 to 10 minutes that you tell them to call you back or whatever, but can help you not get too sidetracked or end up getting misquoted because you're confusing in what you're saying, like I'm doing right now. So I will stop back. Thanks.
All right. Thanks, Greg. I absolutely appreciate it. And, back to the platform specifically, I use Twitter when I did public information work for the state 911 board, mainly to cover events. So kind of another way to kind of do a live feed. So reporters sometimes do that. That's something that you can do. You can definitely use it to post links to news stories or links to your other social posts. But what I have seen most often is Facebook and Instagram. So I think that's important. And I think from my perspective, it would be fun to see someone or several people, integrate TikTok and make that work. But mainly what I'm seeing, so talking about what we do use, Facebook is great for, a paragraph post, a nice picture. Instagram picture, I would encourage you, very short, writing after the picture. So, or text there. But I definitely encourage you, and it sounds like a lot of you are integrating social media, but being intentional and making sure that's part of your plan, so that maybe you see a great post from the Institute or CDC or whatever, there's a great post on your topic and you want to share it, or there's a great post that you want to share that's not based on your topic of the month, that's fine. But I want to encourage you to be very intentional and think about, this is our topic this month, we're talking about this, we're directing people to useful resources, we're controlling the narrative, and kind of what is, I mean, for lack of a better word, kind of a devolved media world where everyone gets their own news based on their own selection. So they're following the people they want to follow and getting the news they want to get, and you're kind of crafting that story, but making useful posts. You know, so to me, the goals of your social media are, again, just like everything else, being intentional, thinking about it in a topical way, integrating your other communications, using multi-purpose materials. So the vaccine campaign is an example of that, where op-eds became social posts and stories. You can schedule your social media. So one of the things I've heard and even saw here is people were posting, you know, people are posting daily or whatever, but you may have somebody who comes in and actually does the post, or if that person's not there, a post doesn't get done, or people have access. But you can use scheduling tools. If you were using Twitter, you could use Hootsuite. Facebook has a scheduling tool. So you could go in and schedule a week's worth of posts on a day and be done. So you don't have to, you know, be overwhelmed by the communications aspect of, you know, submitting an op-ed and then doing social media or whatever. You can take just a few minutes and schedule out a number of posts, and that way that's finished. And then the other piece of that, of course, is determining your response strategy. So, you know, personally, and having some experience in public communication, I think it's important to, I mean, I've heard people say, well, you can just turn comments off, and then that creates a different problem. I like the idea of having one response. So, you know, you don't need to get into long running debates with people. You can have a short response. It could just be, thank you for your feedback. It could be providing some accurate information, you know, but avoiding the long, super involved debates with somebody, to me, is a good way to manage social. And that way you're being responsive, you're not ignoring people, but you're also not getting lost, because that could be that could be problematic. If you're posting something and you just aren't going to have time, you can definitely turn comments off. That is totally okay too. I think that does open you up to, they don't want responses, whatever. But if you're putting out accurate information, that's the most important piece of that puzzle. Pam here says she likes scheduling, but that makes a big difference in terms of your time. You know, again here, being intentional on social media. So it's not just, hey, there's somebody who has access to our Facebook page and they're posting something when we think about it, or there's a neat thing. It's part of a plan. So as you're developing your quarterly communications plan, you're including plans for social. So maybe you have a topic of the week. That's going to be kind of your, as I called it, a long form piece, a newsletter piece, an op-ed piece, but you're also maybe posting 5 times about that topic. You know, which doesn't mean you have to come up with lots more material. Your op-ed can be cut down into 5, you know, daily posts. So, you know, obviously for social, pictures are very important. So being able to have, having a visual element, having a video element, those things can add to that. But in terms of the text content, you don't have to create, you know, 6 or 7 pieces of content a week. You create 1 piece of content and then divide that up. You know, I just want to continue to encourage people to be thoughtful about both topic, and then, you know, I'm going to post every day, so it's Monday, I'm going to schedule out the rest of the week, and it's all going to be focused on this topic. I'm controlling the narrative and the conversation, and that is helpful. You know, we talked about the voices for vaccines. You know, you want your pieces to be digestible. I like to think again in the rule of three, even for social posts, but really for social posts, you probably want one single message, like Greg said. You need to think about material in terms of what works on various platforms. You know, big visual elements, less text, video elements make a big difference and get viewing time. I think I've read that people spend 7 to 8 seconds on a social post is what, you know, maybe they'll read more. So if it takes longer than 10 seconds to read your post, they might miss the message. If they have video or whatever, if there's a video component to it, people will watch for longer. If there's a dynamic picture, people are going to read the text. But if it takes, you know, a period of time, that's not super helpful. What you can do is link to a larger piece. So you can link to a newsletter or an op-ed that's in an online paper or whatever, where people can go get more information if they want it, which is going to be a super small subset of the overall group. So just thinking about that time span and content creation, people are going to decide whether they're going to dig in and read more or come back. You know, people are scrolling through Instagram or whatever and looking at pictures. Your content needs to stand out and catch their attention. Here's just a sample piece. So it's just a Q&A. What are monoclonal antibodies? This was something we did a while back with the Institute, and it's just a definite. Some people were asking this question, and it went to part of how this works. But this is a really short, you know, visual element, little piece of text that defines it, has the basic message to the bottom, you know, get vaccinated, wear a mask, avoid crowd. So this is a simple visual message that makes the point that would be good for social purposes. And that's just the example of a type of material that is out there that you can use. Again, anything you write can be a social post. It often needs a visual element. You can do an interview. You know, the great news now is that most of our phones take great video images, and so you can capture video of an interview and post that. Video definitely keeps people on your site, so that's helpful. But you can also take the text, you know, transcribe an interview, tell a story, and then have a picture. So anything like that you do can be helpful. But you know, I think video can be a big component of that. When you are doing your quarterly planning, you know, think about the social pieces. So you've got your overarching topic, you've got your weekly subtopics, and then how are you going to divide those subtopics, those weekly topics, into daily posts, for example? Are you going to get published articles? Are you going to get even a radio clip you could share, like an audio clip? Is there going to be a video clip? How can you share that to maximize your social reach so you're getting as many people as possible? All right, and then Greg has another great link here on SoCo, so definitely check that out there in the chat. The other thing, and I've mentioned this before, but make sure you schedule. So the biggest enemy of social is time. So it's either done sometimes as needed. So you just come in, someone thinks about it, whatever, it's not consistent. But you know, there are materials out there from the state, from MTPHI, from the CDC, whatever. There are already existing social materials that you can borrow and use and reshare, so you don't have to necessarily create pieces. For now, while I'm here, I'm available to help with that. So if you want to create material, we can create a bank of material together between now and the end of my time, and that can be done. So that's possible too, in terms of creating things. It doesn't have to be overwhelming is what I'm getting at. You can make it happen. There are scheduling tools, so do that. And I have a couple of questions here, but while I have you in this call, What are some things, just from those of you who do social, what would make it even easier for you to do consistent social posts? Okay, so I'm not hearing a lot there, but I just want to let you know that there are definitely ways, for the people that I've talked to and people that sometimes I hear, frustration, that there are ways to make it easier, and that there are resources that you can use or have. Again, my information is here at the end of this presentation, and we'll be sending out some material after the fact, but definitely encourage you to get in touch with me too if you want some help with social, some consulting on how to improve your social, if that's something needed, or if you just want some materials created, we can do that. And then a lot of times, once you have materials for a topic, that doesn't take a lot to adapt those. So the last topic, well, let me see, there's a couple things in chat here. Right, so before we move on to that, there are a couple people who are in the chat. Time and planning, feeling like we are reaching people. So to me, I think a big part of that is making sure, if you're talking about reaching people, that you're engaging consistently. If you turn comments off, you're not going to know if you're reaching people. If you do focus on a topic, that's going to be helpful. If you put out a newsletter, that can be a way to collect feedback, so you can see who's engaging. You can ask people what they're reading, where they're getting their information, so you can survey the community and get a little bit of feedback that way, and that can be helpful in terms of knowing who you're reaching. But I think one of the key tests of is social working is, are your posts being shared by other people? Are you getting comments? Are you getting likes on your posts? So if those things are not happening, you may want to think about what to do, how you can better integrate that. And it may just be people aren't going to interact with every post every day. Part of your job is communicating accurate information, getting people back involved. I think there are a lot of people who have shut down and are not open to public health information, primarily because of COVID over the period of time. And so that's a barrier. I think the way to overcome that is to be consistent, talk about other topics, get people in. When you have live people, in your offices, talking to them about what they do, maybe letting them know, hey, do you know we're on Instagram or Facebook or whatever, but finding ways to reach people there. Let me see. Brandy's put a monoclonal graphic in the chat, so that's available for you if you want to use that. Are there other questions about social before we go on to communication management? And we'll probably take a short break before we do that. Okay, so it is like 5 till 11. So we'll come back in about 5 minutes, just take a very short break, and then we'll kind of wrap the last piece kind of wraps up everything. So we'll talk about what we've talked about today, communication management in general, policy making, social, kind of a wrap up and key takeaways from today's session, and answer any closing questions in about 5 minutes. So take a short break and we will return. Okay, we are back. It looks like we're here. So the final section that we will talk about today, and this kind of gets into topics we've talked about a lot, but to kind of give you a big takeaway or 3 takeaways, talking about overall communication management. How do you manage communications? What are the basic elements you need to have in place? And I wrote down 3 here: clear policy, scheduling, and collaboration. We've talked about this some, and you'll get a sample policy after this is over, but having a clear policy matters. So who's going to talk to the media? When do they do it? How do they do it? Is there an approval or sign-off process? Is there someone, a director, or someone else who needs to look at these documents before they go out? Is there a PIO who tracks every media request? So Pat mentioned that everyone, you know, if you talk to a reporter at all, the PIO knows about it. So this happened, I got this call, I had this conversation, I'm sending out this information. There's a person in your department, even if it's a small department, who kind of tracks that. So the other part of policy making is making sure everyone knows that you have the policy. So it's great to have a media relations policy. It's great to have a communications plan. It's great to have all of that together. You may have a Comms 101 book. You may have a media policy, but you also need to make sure everyone knows about that. So everyone who gets hired in should get a copy of that, because it's possible that anyone will get a media call and they need to know how to handle it. All staff should be trained, you know, at least in the basics of what the policy is. So if it's not your job to talk to the media, you should at least know what to do when you get that call. Maybe that's all you need to know is if you get a call from the press, refer it to our PIO, who is this person, or the department director, or whatever that is. And then how are you managing what comes out? And that again is an important piece of that puzzle. So, you know, are you getting all of the questions in writing and then having that go back out? Does someone need to read it? A lot of when I first started this, and even now, you know, a lot of the stuff for public health is not my background, but in a lot of cases, even if you've been working in the field for a while, you know, having a medical professional look at it, making sure that the science and the medical terminology and all of that is accurate, all of that is important. So thinking through all of that to make sure that when you talk to the media, you're giving out accurate information. This gets back to building trust, having a trusted partner, that piece. The other element to management is scheduling. So, you know, I don't think, and a couple people mentioned this, you know, an annual plan may be overwhelming, but a quarterly plan can save you a ton of time. It also, if you do it quarterly, it forces you to check in. So you can see what was working in the last quarter or the quarter before that. What materials do we have from before that we can use now? Scheduling is an important piece of that puzzle. So, and when you're scheduling, thinking about, okay, so I either have a newsletter or I have a local paper, even if it's monthly. You know, I'm going to send out a press release at least once a week about this topic. Who are people that I can include? Do I have relevant community partners? What are my social posts going to look like? Have I scheduled all my social posts for a week? Do I, you know, you can schedule them for the whole month if you want to, but scheduling a week at a time may make sense to be topical. Thinking about every element of your schedule now, realizing that things are going to come up, issues are going to pop up. You know, March 2 years ago, we were all focused on and learning about COVID. And so that was a kind of a crazy time that became something that might be a problem for a few weeks, became something that we're still dealing with. So your schedule will always get interrupted. But if you schedule and you have a plan, then you're communicating intentionally. You're defining the message. You're controlling what people ask questions about. Got a little bit of stuff in the chat here. Emily mentions that Canva is very helpful in terms of creating materials. That is a great note there. And then I always encourage people to focus on collaboration. So the Voices campaign is a great example of that. There are opportunities, I mentioned mental health, where if you have a topic every month, you can be thinking ahead. So if your quarterly meeting is in February for the months, March, April, and May, you can be thinking about who can we talk to about this topic? Who knows about physical activity and mental health? Is there a trusted partner, a coach, a mentor, someone in the community who can speak out on this, who can write an op-ed? I think Greg's point earlier is well taken, that it doesn't necessarily have to be all health department all the time. You can have someone else carry your message. And you can have a note that says, for more information, come talk to our county health department. Building partnerships with elected officials, with people from the schools, with law enforcement has public health interests as well. So building those partnerships can really help you become better at communicating intentionally and getting messages out for your community. So I have just a couple of questions here. I know we've talked about this a little bit. How many people here, I don't know if you want to raise your hand, or some people just want to talk about it. How many of y'all have a written communications policy for your department? Emily says they do, Emily Weiler. Who else has a written comms policy? Casey says she does. Lilia and Flathead. Amy, specific to risk and crisis, that's really important to start with. Others you want to put in the chat if you have a written communications policy? So the next question, and Amy answered this, but if other people want to talk about it, what is in your communications policy? What is your, Kim also has a risk communication plan policy. That's, I think, if you don't have anything else, you need to have a crisis communication plan. What else is included in your communications policy for those of you who have them? So I see a couple people who have comms policies, and some people, a couple of you have mentioned you have crisis communications policy. Amy, creating messages, psychology of crisis, that's all very important. To me, other elements that need to be in that are some of the things we've talked about. So, who talks, when do they talk, what's the anticipated turnaround time for talking to the media? Is the first preference, questions in writing? Is there a final approval? Amy's saying, there are templates for statements. Having a sample statement, especially for a crisis, is helpful. So you have just kind of some basic guidelines for what to say. I think a communication policy, and we'll send a sample one out, needs to let people know who should be talking, what happens when you get a call, what the final approval process is, how do we know a message is ready to go out to the broader world. And so all of that is important. And then in a crisis situation, and Amy mentions their contacts for local media, in a crisis situation, a crisis communication policy should help you get ready for or respond to. So basically, instead of having to reinvent everything, you're able to go in there and have a template statement, a press release, a list of media contacts, just think about any type of emergency response. Things are going crazy, and you want to make sure you are controlling the message well. If there's a health crisis for whatever reason, you want to be ready for that and want to control the message in a smart way. But then I think for all communication, your communication policy could include, that this department will develop quarterly communication plans, and it could include, key media contacts, social media contacts. Social media should definitely be a part of that. I'm guessing you probably have social media policies for your employees, just in terms of what they do, but also, a communication policy should guide your social media work. How do we interact with the public? Are we going to do one comment? Policies, are we going to turn comments off? How are we going to respond to inquiries? All of that needs to be in a communications policy. Not everybody who works for you is going to need access to this. So there's the very basic, we all understand that there's a media relations person, whatever, and we just acknowledge that anytime we get something, we're going to let them know, and that's all they need to know. People who have access to social media need to follow certain social media rules. When there's a crisis, we follow this kind of crisis communication protocol and figure out what to do, but you may lay out all the steps for managing that. Then the other thing, and as we were talking about this, some of you mentioned you had a designated communications person or media person. I think that's really important. I know in smaller places, maybe there are some of you who have multiple hats. Maybe, everyone who works there or comes in contact, volunteers, whatever, understands there's a designated person who hears communication concerns or is made aware of them. There's a policy. I think that's the other thing. Having everything in writing can help you manage it. That policy can give you a roadmap for how to communicate and communicating intentionally. And you do training. So the relevant people, if you have a social person and a person who's going to be talking to the press, those people should be trained. Those people should be trained. So, Margaret asks, what kind of training would someone look for if they wanted to be better versed? I think there are some PIO trainings out there. So how to be the public information officer is one example, and I know I've talked to a couple of you who have done that. So that type of training specific to public information officers in these types of settings can be really helpful. Doing some simulations, practices, those types of things can be helpful. And I think too, thinking about the very basic communication plan, having people sign that they've got an acknowledgement of the media policy is great, but it wouldn't hurt to do, a training exercise where, especially for a crisis, crisis situation happens, media person calls, you're the one who answers the phone. What do you do? And doing some of these types of in-house practices besides the broader training. And then Brandy's noting some, college courses that would have, media or comms, more intensive media or comms training where you could even a journalism class could help you better understand media relations, things reporters are looking for, how to communicate directly. But I think if you're having a communications plan, it should include, and policy, you should include training on the policy, and your designated people, your social people, your person who's talking to the media should have a next level of training where they whether that's auditing a course at a school or taking a PIO training and getting more involved in simulating the exercise. And that's, to me, that's the best way to get ready. So, this is designed to kind of make you start thinking about these things in an intentional way. But part of that intentionality is who's talking to the media and how have they been trained? And then how are we training everyone else to handle media situations, communication situations? Does everyone who has access to our Facebook page understand our social policy? Does everyone who might get called by a reporter know what to do when that happens? Those are things you should be thinking about to make sure you're communicating clear and accurate information to the public. So I'm mostly finished, and I know this was supposed to be 3 full hours. I hope you don't mind if it's a little early, but key takeaways for me, and this is 4, so this violates my rule of 3 a little bit, but 4 key takeaways. 1, very important to be thinking about communicating intentionally by way of planning. 2, what are you doing in terms of media relations? And to me, relations is relationships. Are you building relationships intentionally over time with reporters in your community? They can be community collaborators. They can help you understand what issues are important. So if the reporters are calling you about an issue, that might be an issue that needs to be a topic. Maybe that needs to get on your quarterly agenda. Maybe you need to be responsive now. Using social media, which it sounds like a lot of you are, but being very intentional and thoughtful and focused on that, making sure social media is not just something you think about after the fact, but as part of a bigger plan. And then overall, communications management. What is your department's communications policy? Who are the people who are trained? What training do you offer all employees who might be communicating in some way? You know, are your frontline employees trained to handle situations? Are your social people trained? Do you have a crisis communications policy in place? And then if you have a specific communications people, media people, what types of training is available to them? So that's the summary of my program for today, but I'm very happy to answer questions either in the chat, or if people want to just ask a few questions, that would be great, and happy to do that. We certainly have time for that.
I have a quick question. So coming into my position, looking at our logo, I was wondering if you have any resources on how to maybe update that. If I know that seems like a silly thing, but ours is pretty much like word block font, and I just thought maybe it would be better to have just a little more updated as we move forward in all of this.
Yeah, I think you know, I don't know in terms of resources. I think certainly at the Institute we have someone who helps with graphics and could help you take a look at that. So you know, I'm happy to be a part of that process if that's helpful to you. You know, you can compare. There's also people who do work in the public health community who do specific you know, logo development. You know, short of a PR firm, I would suggest you know, emailing me after. I'm happy to work with you and through the Institute to at least, you know, give that a once over and see if we can update that or help direct you. So I hope that something like that could be helpful.
That would be great. Do you mind just leave your email in the chat so that I can reach you?
Yep.
Thank you so much, Andy. I really appreciate it.
Yeah. Yeah, Emily mentions very affordable marketing companies, but I will put my email there. And then, like I said, I know the Institute works with people. We have somebody at the Institute who does graphics work. So for Margaret or anyone else who needs that type of thing or wants, you know, logo update, if you need some social work, social media work, happy to look at what you're doing and see if we can recommend any improvements, and then 2, either through our work or we can direct you to some people who can do this at a pretty good rate. But happy to be the kind of the, you know, maybe an initial set of eyes on what you're doing for anybody out there.
I love that people are thinking about that though, because like I have a lot of conversations with our workforce program about enticing new hires and that kind of thing, and that outward facing, you know, your public presence is important. And yeah, if you have a logo that was maybe made in the 80s or the 90s and it's just not quite keeping up, like there's no problem to update it. And same with, you know, I think back in the day it used to be that if a place didn't have a website that was kind of suspect. And then it became, if you don't have a Facebook page, that's kind of suspect. And now it's like, if you're at least having some amount of integration into some of these social media platforms and you update your logo, it just helps. And it's certainly, if you're looking to hire anybody as well, that's something that is certainly the younger generation and the new graduates and stuff are going to be looking at. So I think that's awesome.
Yeah, that's a great point, Emily, about hiring people, and also just in terms of reaching younger people in general. So all of that matters, and so but I think we can do that. What else on any of these topics can I help you with or direct you to in the next few minutes? And I definitely, for those of you, I definitely put my email in the chat there. So if you want to connect with me, if I can be helpful, if I can connect you to resources at the Institute, absolutely happy to do that. Happy to talk through developing a communications plan, having a couple of departments I'm working with now. The mental health example I use as a real life example that I'm working on now with a couple of departments in Montana. And so happy to do that for a lot of you if you need that help. But I don't know what you need until you email me. So I definitely encourage you to reach out. We can set up a call. But I'm done with what I have unless there are more questions or anything I can help with directly.
How did you do the recruiting for the vaccine recipient campaign?
That's a great question. Pam was amazing. I don't know if she's still here, but she actually had this idea because she had a couple people talk to her. And then, I could just kind of said, here are the types of people we would love to see. And then she knew some people who had come in and told their story. And so, she gave me names, and then I reached out and connected and did the interviews. But she, I think it started with someone suggesting to Pam that they wanted to share their story, and then she did the legwork of thinking about who those people were, calling them, asking them if they would be willing to share their story, and doing that. And then there's one other place, and I can't remember all the counties in Montana, but there's one other place that's come to me and said, hey, we'd like to do it. And I just gave some sample ideas of who might be, but really it can be anybody. Parents are great. Stories about kids are helpful, but a range of people. If you have somebody who's come into your health department and they're on fire about, wanting to talk about the vaccine, that's a good starting point. Hey, would you want to share this? Would you want to? Maybe somebody tells you something and you think, hey, maybe you'd want to share this story. So I'm pretty sure that's how it started for Pam, and then it expanded, and we ended up with 6 really neat stories. And I think the other thing is it only takes a handful. It could be 3 or 4. It doesn't have to be a bunch of people. And the other thing I think that happens is as people see these social pieces, they feel more comfortable and they want to share their story. So there's the other element of it is, hey, I saw my friend in a cool Facebook post. I want to look great and be on Facebook, and so that could be getting a couple started. It can be a good way to recruit people.
Andy, can you hear me?
Yes.
This is Pam.
Yeah, great.
So this idea really started back in January of 2021 when we started vaccinating. And as everyone in public health knows, there's been a lot of heartache and a lot of harassment. And so, and a lot of isolation. And it was just really, really kind of nice to be able to be with people again. I couldn't wait to give shots so I could just touch people. But in that whole process, we started hearing voices of people who did appreciate what we were doing and who did, have a why for vaccination. And I've worked with vaccine resistance for a long time. And I know that it's a slow and patient sort of a trail you have to be on. But part of that is figuring out people's whys. And so we knew that people were tired of hearing our voices. And so as we did these vaccination clinics over the spring months, we heard people's stories and why they wanted to be vaccinated, what their why was. So the idea came to me to do the Voices for Vaccines campaign. I was fortunate to get one of our commissioners to be one of those voices, and he had actually been kind of one of our antagonistic voices for quite a while. So I was really happy to be able to get him to participate. But I had heard some of the people's stories, or at least a part of it, and had reached out to them. Most of them were people I already had a relationship with in some way or another. But it was interesting as Andy interviewed them and put these stories into writing that I learned something new about everybody's story as I read them. So there was much more depth to their story than what I even knew. And so I think that's the piece that was really kind of exciting. The last story that Andy did was my daughter's story. And it was probably my most gratifying reading experience because I could hear my voice in her voice. So I was hearing her say that if you're not into the science, then look at the history. And, you know, even though there are some risks, the benefits of vaccination truly outweigh those risks. So it was really a rewarding experience. Andy was great to work with. I know Dawson County's AmeriCorps reached out to me. I think they're going to be the other one trying to do this, but it really was a good experience and it was a fun experience. The picture that Andy showed you of Brett and Terry, our ranchers, I got more hits on that on social media than any other post, except for the one when we released our mask mandate. So just saying, that's where people are at, but it was really kind of fun. So anyway, thank you, Andy, for helping with that. And the only real disappointment I had in the whole process was we tried to get a primary care provider to be a voice, and we weren't able to get one tacked down long enough to get an interview with. So I know Andy tried multiple times, and I gave him multiple people to try with. So thank you, Andy. And I really would like to be a part of your Voices with Mental Health. I think, you know, reducing stigma is something that happened with the Voices for Vaccines campaign, and that's definitely where we want to go with mental health too. So thank you.
Thanks, Pam. And yeah, that campaign was a lot of fun, and it gave me a great chance to talk to people outside of public health in Montana. And so that was neat for me to kind of hear those stories and get to retell them. And then I'm not a graphics person. We have a graphics person at the Institute who made the pictures look great. But happy to do that in other places if that's something you still want. I know, you know, some people think COVID is over or whatever, but if that's a topic you're interested in, and then Pam alluded to, I'm already doing some work on mental health, but would be happy to do a similar campaign around mental health. That seems to be a topic that pops up a lot. So, but are there other questions or other things that you want to know before we end today? Okay, so if not, I have had a great time just talking with you a little bit about communications and communications work. This presentation, I think, has definitely been recorded. You should be able to get access to this outline if it's helpful, and then I'll be sending along to the kind of media guide that I alluded to, so that will go out, I think, with everything else. So you can have all of that, and then my email address is in the chat. If you want to get in touch with me, send me an email, and then we can talk about social media and media planning. If you want help developing a plan, I've just done for a couple of districts, worked with them on a quarterly plan, so happy to do that. But want to be available as long as I'm here. So I don't know if Emily has anything else to close, but that concludes my presentation.
Thank you so much, Andy. This was fantastic. I did put a link to our little evaluation survey into the chat. So if you can take a moment, it's very short, helps us to keep fine-tuning trainings and find out what you guys need and what you liked about today's training. So take a second and fill that out. And thank you. And like Andy said, we'll be sending out a bunch of resources for you we should be good to go. So thank you. And it's always kind of nice to get out early too.